Good afternoon, everyone. So this one is working. Is that okay? Yeah. Thank you. So I'm going to. We've been listening to multiple stories of multiple organizations for the past 1.5 hours, and it's been an interesting journey, and we have learned a lot from everyone. And I'm going to talk about the story of LV Prasada Institute and how we have grown. Other- So, LV Prasada Institute is a non-profit organization working towards preventing a needless blindness and a vision impairment. This story started in 1986, where one person's dream to give excellent eye care and reconcile it with equity and get that to the population where he was in. And that's where, and we started in road number 2, Banjara Hills in Hyderabad, with a small two-story building. And 35 years later, we have reached a place where we have three tertiary centers and one center of excellence spread across three states and 20, 22 secondary centers, which goes into the smaller towns, and 250 vision centers, which goes into a smaller remote rural villages, so that all may see. So how did we reach there is what we am going to talk about. So in the beginning of our journey, we did an epidemiological study called Andhra Pradesh IDC study, which gave us an information or an insight into what was the need of the population. Though we started giving an excellent eye care at Hyderabad, we realized with this study that there is much more and the need is more down in the deeper areas. So that's what made us change our path at that time and went into developing a pyramidal model where we reach where the need is. So that's where in the remote and rural villages. So this is our pyramidal model where we have a vision guardians serving 5,000 population and the vision centers manned by a vision technician in the remote rural villages which are serving to 50,000 population. And the secondary centers where a simplest of cataract surgeries and some of the simpler surgeries can be done at secondary center for a population of 5 lakhs. And at tertiary centers where we do complex surgeries are including or take care of all the complex issues, which is around 5 million population. So how does this work? So this works, this is an example of what we could do with the pyramidal model. This is a small baby who was in remote rural village of Andhra Pradesh, where our vision technician sitting in the vision center could pick up, there is a white reflex, and with the technology of a teleconsult could transfer those images to the tertiary center and able to identify and refer that patient to the next level where we could take care of the retinoblastoma and treat that patient and bring back the life and the smiles back to that patient. This is how an integrated approach, and these patients can be followed up back in again in the vision centers whenever there is a need. So, and all this with the technology enabled centers where the patient once under a system can have it, can be tracked anywhere, wherever it is using electronic medical records. So, using the pyramidal system from screening to the management of most complex diseases, uh, at the same time, where we cannot help, vision rehabilitation is something which we always wanted to help people who cannot see and help them achieve their independence and confidence in gaining that. So when we started LV Prasad Institute, we had three primary functional arms. It's a patient first, is a patient care, which is there behind in all we do. Education and research. These are the three basic functional arms with which we started. Over a period of time, we realized the need and we started an eye banking, capacity building, rural and community health, and vision rehabilitation. Of late, the recent additions to this are technology and innovation and product development. As I said, the patient care or patient first is our main motto. We keep up with the patient care technologies and keep up with all these technologies which are coming up. We have seen multiple technologies coming up, but at the same time, not losing sight of the community at large. So we use this technology to reach people and make sure that nobody goes needlessly blind. And so that's what we want to do, and we are doing. And with the referral management, like what I was talking about, you're able to take care of whatever may be the simplest or the complex of issues closer to the doorstep to the extent possible. And where it's not possible, your referral system will take care of them and then send them back to where they are able to take care of them there. iBanking is something which we started when in the early part of our journey, realizing that the need for eye tissue, which is lacking in India. So, and there is a lot of corneal blindness which was seen. So the iBanking with the hospital recovery program, we could reach a stage where we are harvesting 10,000 corneas in a year and are able to distribute almost like 8,000 corneas in a year. This distribution doesn't happen only in LV Prasad Eye Institute. Almost 50% of them will be given to the people, the cornea specialists across India. So this is not just for LV Prasad Eye Institute Eye Bank, it's for the whole pan India. At the same time, we believe in building a capacity. So we helped developing other eye banks across in India so that we don't have a corneal brainless problem. At the same time, we are talking about education. So when we started in LV Prasad Eye Institute, before we started the clinical services, the education has already started. We started first with an education programs. The reason is at that time, we realized education is something which is going to take us go to the next level, always. So we train all cadres of eye care cadre, right from vision technicians to the ophthalmology fellowship programs and PhDs. So we have multiple collaborations across the world where we have programs running together. One of the unique program which we have started recently is a master's in ophthalmic engineering with IIT Hyderabad, where we include this program for all those people who wanted to innovate and get an understanding both for engineers and doctors. It's a combined program where they can understand the other component of their field. Like I wanted an ophthalmologist understanding the engineering and engineer understanding the ophthalmology, so that you can do a better job in innovating things which are needed for the people. At the same time, we looked at the needs. It's not just in India. So we looked at an area which is in West Africa called Liberia. There was a need there and there was a request from them. And we started building our own network there along with the help of the government there. Then we realized there are no ophthalmologists available in that place. There is no residency program. So we started residency program to train an ophthalmologist and then help them grow the model there in that area. So this is the first set of ophthalmologists who come out of our program with the residency there. Research has always been our main focus right from the inception, but the main focus of research is translational research. So when we talk about research, it's not just a publication, it's about how to get this research to the patient who's at the bottom of the place. Backed by the labs which are well equipped with the scientists, the basic scientists and clinicians and the clinician scientists, we're able to translate this research into few of the techniques and technologies which we can transfer to the patients. So that's what resulted in more than 5,000 publications we have made and few of the technologies which we have able to give to the patients. We talk about newer innovation and innovation technology arm which we started recently. Again, here the focus is mainly on the last mile connectivity. So if you look at the instruments which we have developed, like uh, handheld instruments or the visual field measurement machine or a pediatric perimeter. So these are the ones which are focusing on areas which are not there, or the technologies and techniques which need there, and when you are dealing with the patients in the remote rural villages. That's a main focus area for a technology and innovation center. But along with that, we started something called a BioNest, which is an incubator where we have an engineering department with all state-of-art technologies. If anyone with a new idea or innovative idea wants to develop that, what we realized is there is not much of a support around. That's where we want to put our help there and say that we are ready to help you to realize your dream. That's how we can make a difference to people. So this is a BNS which we have started new, and where we have already have 4 incubators working with us and working with them and making their dream realize. Not but not the visual rehabilitation is one thing which we always forget most of the times when we are in the clinic, but that in LV Prasad Eye Institute, that is something which we always focus on and make their life better. So in overall, we could touch 34 million people, but most importantly, 50% or more of them are served at no cost to the patients, with the basic principle of no patient who comes to our services should go back without getting a treatment done due to lack of money. With all this, what we have achieved is many accolades across the world, and one of them is we are ranked 8th among eye health institutions in research and by Schemago ranking, and a Greenberg Prize, 4 of Shanti Swarup Bhatnagar Awards, and 3 Padma Shri Awards. We could achieve all this by visionary leadership with values of patient first, excellence, equity, integrity, and doing all this with togetherness, with a committed and extraordinary team, and friends and family support across the globe with their time, treasure, and talent. We could achieve all this. In summary, I would say LV Prasad Eye Institute is committed to contribute towards eradicating needless blindness, build partnerships with national and global organizations to achieve that so that all may see. Thank you.
Thank you very much, Rajiv. That was, of course, to me, it was wonderful to be part of this, and I'm sure everybody else has benefited from knowing about the glory that is LV Prasad Eye Institute.